Okay, this is the 10th and the last session in acute pancreatitis critical care station in MRCS Part B OSCE exam. And this is Dr. Rezi. I hope that this will help you to pass this station if it show up in the examination. And just remember to subscribe to this channel if you want to get the lectures, because they are irregular. Okay, well, so now we are finishing this station and you have only three questions, 2 or 3 questions that are remaining. Okay, and the first question here is that it is not related to anything. As I told you before, they are going to test you in many things, and these many things may not be related to the station itself. So the first question will be, how do paracetamol overdose? You know that some people get suicide with paracetamol overdose. How does that happen? He's going to ask you how. Tell me about the mechanism, why that happens. Okay. And actually paracetamol overdose causes something called liver injury. Okay, and to be specific here, you want to tell the mechanism by which this injury happens. First of all, there is a metabolite that is produced from paracetamol when it is taken, and that metabolite is called NAPQI, N-A-P-Q-I, NAPQI. Okay, and this is chelated by glutathione. Okay, so glutathione is a 3 amino acid protein structure produced by the liver. Glutathione itself, if given from outside the body ready, it is toxic, but if you give the amino acids that can produce it and allow the liver to make it, it is fine. It is an antioxidant, a very strong antioxidant. So the chelation of the NAPQI or NAPQI, which is a byproduct of paracetamol metabolism, it is toxic. Okay, this chelation or this removal from the circulation is made by glutathione. Okay, and glutathione is produced by the liver. Okay, so when this structure is too much, the glutathione will be finished. It will be depleted. Okay, it will be depleted, and in this way the toxic metabolite cannot be metabolized or removed, and its accumulation will lead to liver failure and death. Okay, so this is the answer for the question about paracetamol toxicity or overdose. The second question, they are going to ask you, how can you differentiate between a pseudocyst and a tumor? How can you know that this thing in the abdomen of the patient is not a tumor or a cancer? Okay, so the first thing that you want to remember here, number one, you are going to do an ultrasound, right? An ultrasound is for both. It will show you something about the nature. You are going to do a CT scan. This will also help. Okay, and you are going to do something called fluid analysis, and in the fluid, okay, you are going to check the viscosity. Fine. So if it is a pseudocyst, the viscosity will be low. In the tumor, the viscosity is high. Okay. The third thing here. The fourth thing, and actually the most important thing, the amylase is usually high in the pseudocyst, as we mentioned before, and it is low in the tumor. So you are going to say to the examiner, I can differentiate between pseudocyst and a tumor by ultrasound first, then after that I will do a CT scan, I will take a sample from the fluid and check its viscosity. If it is low, this is a pseudocyst. If it is high, this is a tumor. And I will check amylase in the fluid of the cyst. If it is high, this is a pseudocyst, and if it is low, this is a tumor. Okay, so thank you very much, and I'm going to see you in the next stations. Thank you.